Good afternoon, amazing First Light caregivers. This is Monday afternoon on March the 16th. This is Paul Jones, and I want to take a few minutes and talk to you guys about the coronavirus response, what we're doing, and just give you a general update. I'm going to start doing these at least once a week, so watch your text messages, watch your email for these videos. First of all, I want to thank all of you again for the amazing work that you're doing. It's phenomenal. I love how everybody is pulling together. When something like this happens, it's beautiful to see. And I know your clients appreciate it, and we certainly do here. And right along with that, please understand that our number one priority is your health and safety. And so we are taking steps to make sure that you are safe in the community doing the work that you're doing. And the way that we are doing that is we're following all the guidelines from the Center for Disease Control, or the CDC, particularly as it relates to social distancing. And so we have canceled events that we were doing in the community. All of Miss Renee's marketing and networking, she is not going out into the field, and that's to make sure that we are not exposing ourselves to something that we could then pass on to you. We're also communicating with all of our clients and making sure they report any symptoms to us. And I can report to you as of today, we've heard 0 symptoms of any type with our clients that indicate the potential for coronavirus infection. We've had some of our clients cancel services temporarily because they have a suppressed immune system and they're just worried about any kind of exposure to other people, which we totally understand. And if that affects you, you already know about it. And so, but there's still plenty of opportunities to work. So if you have questions about any of that, please call the office and speak to Matthew, and he'll make sure you get connected so that you're out there taking care of folks that need help. So that's it. Number one, your health and safety is our biggest priority, and we want you to know that we are still continuing to monitor that very closely. Second, please continue to follow our infection control plan. What's the most important thing you can do? Wash your hands, right? For at least 20 seconds under warm, soapy water. And continue to make sure you're wearing your gloves anytime you're interacting with a client. If you're out of gloves, come by the office. We've got plenty. We just had some delivered today, so we're in good shape there. And then again, in terms of our infection control, if you are experiencing any symptoms like a high fever or shortness of breath or a dry cough, or a combination of those things, please call us and let us know, and then we will direct you on getting the appropriate health care that you need to make sure that you're safe and your family's safe, okay? Otherwise, it's business as usual. You know, we're out there doing good work, taking care of people that need us, and I appreciate you guys so much for that. And the last thing I want to say to you related to that is, for those of you that are working with clients and you are normally going out and doing a lot of things in the community, but now we're asking you to engage in social distancing. And by the way, what that means is the Center for Disease Control has asked all of us to do this, and we want to follow those guidelines. So that's to avoid crowds of 25 people or more, where people are kind of close together, like going to restaurants or going to dining halls at some of the assisted living communities, those sorts of things. And when you're out in public interacting with someone you don't know, to maintain a distance of at least 6 feet. And if you do that, you're doing your part to make sure that the virus isn't spread easily from person to person, and that you stay safe and your clients stay safe. So if you're not going out and engaging in the community like you would normally do, it's really important to make sure that you are engaging your client personally when you're with them in their home, so that they're not sitting in a chair checked out and you're sitting over here checked out, but that you're doing things together. And sometimes when you're stuck in the house, you forget that and you're not quite sure what to do. So things like looking through picture albums together and telling stories about things that used to be when they were younger, or about their children. Just looking through family photo albums can be a blast. Playing games together, working crossword puzzles, working actual puzzles. There's so much fun that you can do there. Of course, watching TV, that's an easy one, but reading to your client, finding out what books they love and reading to them and getting involved into a story together could be just an awesome way to spend time. So those are just some ideas off the top of my head, but we really want you to focus on your engagement with your client while you're at work, particularly since you're not going out into the community doing things you used to do. If you have any questions about how to go about that, like you don't have access to puzzles, you're not sure what to do, call us. We'll provide you anything that you need to make that work for you and for your client. And that's it for today. So to recap real quickly, your health and safety is our priority. Make sure you're reporting any symptom to us and continuing to practice good infection control. As of today, we have 0 symptoms of coronavirus and 0 positive tests of any kind amongst our employees or our clients, and we want to keep it that way, okay? And then lastly, that caregiver engagement with your clients when they're in their home. So thank you guys again for all that you do. Watch your email and your text messages. I'm going to do these at least once a week, more often if necessary. Stay safe, and I will see you soon. Bye.